Hi all, I'm Malavika and in this video I'll be explaining about organophosphate poisoning. Organophosphorus compounds are irreversible anticholinesterases. They can be used as insecticides and as biological weapons. They increase the concentration of acetylcholine at muscarinic and nicotinic sites. Examples include parathione, malathione, diflos, and ecothiopate. Symptoms of organophosphate poisoning can be divided into three types: muscarinic, nicotinic, and central. The muscarinic effects can be remembered from the word muscarinic itself. U stands for upset or gastrointestinal upset, so there will be abdominal cramps and vomiting. S stands for increased secretion of sweat, saliva, tears, and tracheobronchial secretion. C stands for contraction of smooth muscles, so there will be pupillary constriction or meiosis and bronchospasm. C also stands for cardiovascular system, so there will be bradycardia and hypotension. I stands for involuntary urination and defecation. Nicotinic effects predominantly affect the skeletal muscles. There will be twitching, fasciculations, muscle weakness, and paralysis due to prolonged depolarization. Central effects include headache, restlessness, confusion, convulsions, and coma. Death can occur due to respiratory failure. Organophosphate poisoning can be diagnosed from previous history of exposure to organophosphorus compounds, presence of signs and symptoms of organophosphate poisoning, and decreased cholinesterase activity in blood. Treatment of organophosphate poisoning: wash the skin with soap and water. Perform gastric lavage till the returning fluid appears clear. Maintain airway. Perform artificial respiration. And in order to control convulsions, slow IV diazepam can be given. There are two specific antidotes for the treatment of organophosphate poisoning, namely atropine, which is an anticholinergic, and oxymes. Example: pralidoxime and obidoxime. Dosage of atropine: 2 mg IV start has to be repeated every 5 to 10 minutes, and the dose may be doubled if necessary. Atropine is continued till the patient has dilated non-reactive pupils and tachycardia. For oxymes, it is 1 to 2 gram slow IV. The mechanism of action of atropine is non-selective, competitive muscarinic antagonism. Atropine competitively inhibits acetylcholine at the muscarinic receptors. It has to be noted here that atropine has no effect at the nicotinic receptors, so it cannot be used to treat muscle weakness in OP poisoning. The mechanism of action of oxymes is cholinesterase reactivation. So acetylcholinesterase has two sites, an anionic site and an estratic site. Organophosphate binds to the estratic site, while the oxime binds to the anionic site. Organophosphorus compound phosphorylates the estratic site, thereby deactivating the enzyme, while the oxime performs dephosphorylation, thereby activating the enzyme. So that's all about organophosphate poisoning. Thank you for watching.